Yeah, dental implants, I mean, man, if you asked me 10 years ago what dental implants were, I'd say it's a completely different thing. There's so many patients who walk in, they're like, oh yeah, you know, the implant I have up here, they had to pull the tooth and put a bone graft in, then wait 4 months, then place an implant, then wait 4 months, then make the tooth. That took a month. And it took like 8 or 9 or 10 months to get a tooth. And now we have 3D x-rays. And so when we have something 3D, we have a 3D rendering of the jawbone, where all the vital structures are. We know 100% where everything is. And you can even 3D print the model, which is the coolest thing. And you can do the surgery ahead of time before the patient ever comes in. So from the perspective of the technological curve that's occurred within implant dentistry and the improvement in the designs on how successful they are, it is night and day. I can place implants faster than I can do fillings these days. So I would equate a dental implant to an artificial tooth root that's there to replace one single tooth, or it can be there to replace several teeth, or it can be there to replace all your teeth.